I'm Timothy O'Boyle. I'm an ophthalmologist at Professional Eye Associates. Macular degeneration is also called age-related macular degeneration, so it's certainly a condition that we see more commonly in our senior citizens. It's a disease that involves the retina, which is the nerve tissue in the back of the eye, and more specifically involves the macula, which is the central part of the retina. This disease can cause blind spots in your central vision. Macular degeneration is primarily a condition of older people, so a major risk factor is age. Family history may play a role as well. Many of our patients have family members who have the disease as well. Tobacco also plays a role. We definitely recommend people quit smoking. UV radiation exposure to ultraviolet light, so it's more common in certain parts of the world where the ultraviolet light is more intense. And finally, we believe diet plays a role as well. Macular degeneration is primarily diagnosed through an eye examination. When you come to our office, we will dilate your eye and we will look very carefully at the macular tissue. If we suspect macular degeneration may be developing, we may recommend imaging. At Professional Eye Associates, we have the latest equipment that can help us diagnose even the earliest findings consistent with macular degeneration. Macular degeneration exists primarily in two forms. There's a dry form, which is primarily deterioration or degeneration of the macula. There is also another form called the wet form, which means in addition to the deterioration, there's also bleeding or fluid. That condition can be treated. For the dry form, we primarily recommend the use of certain vitamins. These vitamins have a specific formula that the eye doctor will talk to you about. We also recommend no smoking, we recommend some dietary modifications, and we certainly recommend protecting your eyes from sun exposure. If you're diagnosed with the wet form, you may be recommended that you begin treatment with new medications that are actually injected into the eye, which can dry up the blood or the fluid that's present in the macula. These treatments have been very effective for our patients. If the wet form is diagnosed, certain medications may be recommended for your eye. These medications are actually put into your eye in a very safe, controlled manner. We at Professional Eye Associates have done thousands of these procedures and have very excellent results.